I had gone to my optometrist, and it was getting harder and harder for me to see the letters on the wall. And he had detected cataracts. And the first time he said it, it really stunned me because I thought, you know, I'm really young. And he said, usually this is not the case until like you're in your 70s, and I was in my mid-50s at the time. The vision was starting to get worse and worse, and he said, this is something that you now need to address.
Mr. Rosa actually was referred to me because he had cataracts, but he also had high pressures and a concern for glaucoma. Cataract is basically a cloudiness of our natural lens that happens over time. What patients basically describe as decreased vision. They get glare at night from headlights especially, and basically a decrease in their quality of life. Glaucoma is a disease process that causes damage to the optic nerve. It can ultimately lead to vision loss, and patients can go blind if they're completely untreated. The number one thing that we want to do for every patient that has high pressure or is, being evaluated, we want to treat the glaucoma first. That's very, very important. Cataract surgery is beneficial in patients, but if we go into cataract surgery and the pressure is not controlled, sometimes the pressure can actually fluctuate a lot with the cataract surgery. So we worked with Mr. Rosa, finding out what medications worked well for him, and we found the medication regimen that got his pressures under control.
She is very, very specific with what she wanted in terms of, this is how we do it. And in order for you to be successful, this is what you have to do. So once those pressures were stabilized, that's when she did the surgery.
How's everything going? So after his cataract surgery, he was able to see clearly for the first time without glasses, which was really great for him. And then he was able to drive back at night and not worry about the headlights glaring. Really things that had impeded his quality of life before the cataract surgery.
Prior to me having this surgery, the vision was so impaired that it was hard for me to drive. And I stopped driving for 6 months at night because I couldn't see signs anymore. When I got into the car after both of those eyes were done, I'll never forget, I was driving down Route 83. I could see 6 green lights. That's how far I could see.
And he also was very anxious about the diagnosis of glaucoma, which is very, very normal, and I think that he has really done very, very well in preserving vision, preserving quality of life, and really giving that back to patients is just so important.
She takes her patient care very seriously. She's done a wonderful job, and that her manner with patients is exceptional.
Unfortunately, glaucoma, we can never know the full course of the disease. Glaucoma is a chronic process, so that's why as a glaucoma specialist, we get to know our patients very well because we see them from years and years and years, and we just do the best we can for them to keep their disease under control.